All right, welcome back. Very pleased to have Dr. Fritz Rau with us. Of course, he has been a surgeon in our area for many, many years, and he was just honored by Terrebonne General Health Systems with the Golden Stethoscope Award. And Dr. Rau was chief of staff. He's done a lot of things. You recall, I don't know if I had a 1 and 3 or 1 and 4, I can't remember, but it was a fun show with Dr. Rau and your brothers. But first of all, congratulations on a great career.
Thank you. Thank you.
Yeah, it's been a.
Hopefully it'll go on a lot longer. So
yeah, I mean, you're not through yet.
Yeah,
You've been able to follow that dream.
Right.
And in Terrebonne General Health System, Golden Stethoscope Award, they always honor someone prestigious in the community, and it's got to make you feel good.
Sure, definitely does. Especially when you look at the other doctors who receive it. It's a very distinguished award, and it's nice to be in that group. So
yeah, when did you decide? I know I probably asked you this on the one-on-one, but when did you know you wanted to be a surgeon?
I went to college, and my brother went into pre-med, and I didn't want to do what he did. I went into pre-law. But shortly after that, I wound up going into medicine and when I was in college, and I worked in the emergency room at Terrebonne. And right then and there, I liked these guys. Back in the day, they didn't have ER doctors. People would get in wrecks, all this trauma, and these guys would come out and either fix them up right there in the emergency room or roll them upstairs to surgery. And I always thought, wow, pretty nice to be able to do all these things,
Yeah.
So
38 years later.
Yeah, done a lot of it.
Yeah. Let me ask you, Dr. Rau, because nobody ever planned for COVID to come in their career. Y'all career, I don't want to say it's routine because a surgeon's career is never routine. You're going to see a lot of things you never see, or most physicians who specialize won't see. You see every kind of accident, every kind of injury. But then along comes COVID.
Wow, what a change.
It changed everybody. What did it mean for you?
Well, for us, I mean, obviously we're part of the medical community and the community itself, so a lot of the restrictions were there, but our surgery elective type surgery was very difficult to do, and we had to be really careful about operating on patients. We were exposed, and then, of course, we would also have to go to the ICU and other wards and treat patients with COVID. So a little bit intense, but, we all kind of made our way through it, and I think we learned a lot from that.
Let me ask you, then comes Hurricane Ida.
Wow.
And I know that you were old enough to remember Hurricane Betsy. I was young. You're a little bit older than me, but probably Betsy, pretty vivid in your mind, but then Ida makes everybody forget about Betsy.
Well, actually, Ida is the first time since I started doing surgery in 1979 that I actually went a whole month without doing an operation. We had no hospital, no office, no phone communication, no internet. It just totally shut down any type of organized medicine in the parish. It was really
and it took a community and some very driven people to get the medical facilities back in line, and it's happening and it's progressing. But I guess you never thought you would ever been put in that position.
No, it's a very unusual thing, and it's hard to even imagine. I mean, we actually had a community where anything you had to leave this whole area to find a hospital to be treated at. It was really impressive.
Yeah. When you look at your experience, and of course you were chief of staff too, so not only do you have your duties that you do every day, but then chief of staff, you got everybody else's duties that you do. How did that change for you?
It's funny. You always say, well, I'm just tired. I don't know if I want to do that. And anyway, Eric talked me into doing it and said, you really should. You're in a position where you want to see what you can do to help out and all whatever. And I learned a lot. It was a nice experience. You appreciate the runnings of the hospital, and you're always waiting for the problems. And I didn't have too many bad ones during my time. But it was a nice experience. Actually, I enjoyed it.
Yeah, no doubt. And so you've been able to take that knowledge, bring it to a board level, and as you see young doctors coming up today, and they're all full of energy and ready to go, and you've been through it, and you could look at it from a practical standpoint and go, okay, here's where I started, here's how things have changed. Do they often come to you and say, Dr. Rau, what do I need to know?
I don't have a lot of the doctors asking advice. It's funny, by the time you finish your training, you pretty much have an idea what you want to do in medicine and what to do. You've been doing it for a while. And so I remember when I came in with Dr. Phillips and it was a little bit intimidating, but he was such a nice guy. But here you are in the office, and he'd call me in the room and ask me about a patient. And I walked out of the room and I said, what are you thinking? I mean, you're the one that's been here for 40 years, and you're asking me about these little problems. And he goes, let me tell you something. I've been doing this a long time, but I never thought I knew everything. So you always got to keep your mind open and realize that other people have a lot of input and a lot of smarts there too. So.
And maybe also recognize that some of the younger surgeons might have had a whole different approach that they learned.
Yeah. Well, we try to stay current in that, but no doubt. Yeah, I mean, you got to keep your eyes open, and you surely don't think you have the only way to do things. It's not a good way to be in medicine.
Yeah, y'all stay current, but y'all brought some innovative procedures to the area that no one ever thought would be here, and it worked out pretty well, didn't it?
No doubt. No doubt.
All right, well, Doc, congratulations. I know we're going to be getting you on quite a bit on the foundation that you started in your late wife's name. So, and we look forward to helping you with that and spending some extended time to do that. But congratulations on being honored, and a lot of years at Terrebonne General, and I know the community appreciates it, and everybody who's been associated with you guys appreciates it. And congratulations, and many, many more years.
I hope so. Thank you. Enjoy it.
All right. Dr. Fritz Rau, once again honored by Terrebonne General Health Systems. We'll take a break, and like I said, we're going to have him on a lot more in the upcoming future, as HTV is going to try to get involved with that partnership he has with a lot of people in the area. His late wife raising money for a lot of great causes. We'll be right back.